The best research that we have available hasn't actually shown any benefit for the addition of the surgery to high quality structured rehabilitation on its own. So this is in terms of pain, in terms of symptoms in general, mental health and quality of life, return to sport rates, osteoarthritis and meniscal tears, as well as meniscal surgery rates. There doesn't seem to be any additional benefit for having the reconstruction early. There are inherent risks and harms associated with this procedure. There was a really high quality study a couple of years ago that showed that there is actually double the amount of inflammatory markers and response within the knee joint at a 5-year follow-up. So that's an important consideration for patients or athletes that are about to undergo it, the procedure, or considering it at least. Psychologically, if you have high fear or if you have poor self-efficacy or self-confidence within your knee, you're probably at risk of having a poorer long-term outcome as well. There's also just the risk of having surgery. For having the surgery, you're going to have increased blood clots, you're going to have the risk of infection. Where they take the graft from at your hamstring, quadricep or patella tendon, there's risk of damage there long-term permanently, and risk of the muscles that are associated to the tendons repeat straining. So that's also important to know. So absolutely, the sooner the player or athlete can get into physiotherapy and rehabilitation, as soon as that can get started, the better. We can get their pain down, their swelling down, their movement better, and them stronger. If they commence that straight away, it'll have a good outcome long term. If we can get their thigh stronger and get them committed to the rehab, it's highly predictive of them having a successful outcome, whether they have surgery or not. And psychologically, we really want low fear. We really want the athlete and the patient motivated to get back to sport, and expectations. So if you expect that you're going to get better, you tend to get better. If you expect you're going to have a poorer outcome, you tend to have a poorer outcome. So these things are really important to consider with an athlete or patient. We have to sort of look at them as a person and not just the injury itself. No, not at all. I'm certainly not anti-surgery, and surgery is always an option, but really the key message for me, for the general public, for patients and athletes, and for clinicians that are involved in the management of this injury, if we start with a intense, individually tailored strengthening program, we're going to get superior benefit either way, and I think that's a fantastic news really for society as a whole.